Good morning. I'm Dr. Escobar. How are you feeling today?
Good morning, doctor. I'm feeling okay. Just a little nervous because I don't usually come to the doctor and I'm not sure what to do expect today.
That's completely normal. Try to relax because we are just going to talk and check a few things. So, first, what is your name?
My name is Natalia and nice to meet you.
Nice to meet you, Natalia. How old are you?
I'm 22 years old. I just turned 22 a few months ago.
Okay. And where are you living at the moment?
I live in Cartago with my parents and I moved there about 5 years ago. I've gotten used to living in this area.
Okay. Right. What do you do for living?
I work as a logistic coordinator at a distribution company. It's mostly office work, so I spend many hours sitting in front of a computer, organizing shipments and schedules. Sometimes I work 10 or 11 hours a day.
Understand long periods of sitting and stress at work can affect your health, but we will talk more about that later. Now, I need to ask about your family's medical history. Does anyone in your family have diabetes, high blood pressure, or heart problems?
Yes, my father has type 2 diabetes and my mother has high blood pressure. She takes medical medication every day and she has regular medical checkups.
Okay, thank you for telling me. That information is very important. Do you have any allergies to food or medicine?
No, I don't think so. I've never had any bad reaction for to food or medication that I can remember.
Okay, good. Now I'm going to check your weight and height.
Okay, I think I gained some weight recently because I haven't been exercising and my routine has become very sedentary.
Okay, you currently weigh 92 kilograms and your height is 1 meter 65. These give you a body mass index in the obese range. And I'm telling you this because it can be related to your symptoms.
Yes, I understand. I know I haven't been taking good care of myself, and I feel worried about my health now.
Don't worry, the important thing is that you came today. And now tell me, what symptoms have you been experiencing?
For the last few months, I've been very thirsty all the time, even after drinking water, and I also go to the bathroom very often, especially at nights, and that makes it hard for me to sleep well and feel rest.
Okay, I see. Have you noticed anything else?
Yes, I feel tired most of the time, even when I don't do much physical activity. Sometimes my vision gets blurry, and small cuts or scratches take longer than usual to help heal.
Okay, how long has this been happening?
Around maybe 4 or 5 months. At first, I thought it was just stress from work or lack of sleep, but the symptoms didn't go away.
Okay, I'm glad you decided to come because these symptoms may be signs of diabetes. But we will need blood tests to confirm it. But we must take this possibility seriously.
That's why I was afraid of. My father has had many difficulties with diabetes, and I don't want to go through the same situation.
Yeah, I understand your concern. And the good news is that when diabetes is detected earlier, it can be controlled with proper treatment and lifestyle changes. So now I would like to know more about your eating habits. What do you usually eat during the day?
Honestly, my diet is not very healthy. I often skip breakfast or just drink coffee with sugar because I'm in a hurry. At lunch, I eat fast food or fried meals, and I usually drink soda. Dinner is late and sometimes very heavy.
Okay, how many sugary drinks do you consume in a day?
Maybe 2 or 3 sodas and sometimes juice as well, especially when I feel tired at work.
Okay, that is a high amount of sugar. Do you do any physical activity?
Not really. I used to go to the gym on weekends with a friend, but I stopped because of work and lack of time. Now I mostly sit all day.
Okay, thank you for being honest. I'm going to order some tests for you. Fasting glucose test, hemoglobin A1C test, and we will also monitor your blood pressure because you could be at risk of hypertension.
I didn't know diabetes and high blood pressure were related. I thought they were completely different problems.
Yes, they often appear together, especially in people with little physical activity and excess weight. But this combination can increase the risk of heart disease.
Yes, that makes me feel worried and a little scared about my future health.
Yeah, that is understandable, but remember that you can improve your health. Let's talk about some changes that you can start today. So first, reduce or eliminate sugary drinks and drink more water.
Okay, that will be difficult because I'm used to drinking soda every day, but I will try to change that habit little by little.
Okay, well, second, try to eat breakfast every day and include more vegetables and grilled foods instead of fried ones.
I think my family and I will need to change our habits together so that it becomes easier for me.
Yeah. Small changes can make a big difference. And also try to walk at least 30 minutes every day and you don't need to go to a gym because walking regularly can help control your blood sugar.
There is a park near my house. I can start walking there in the afternoons after work.
Yeah, that's perfect. When I check your blood pressure earlier, it was slightly elevated, so we need to keep an eye on it.
I hope I can improve it without medication if I follow your recommendations carefully.
Many patients can do that with better habits and weight loss. So now, please go to the laboratory today for your blood test, and we will meet again in a couple of days to discuss the results.
All right, doctor. Thank you for explaining everything so clearly. I feel more calm and now uh, are more motivated to take care of myself.
You're welcome, Natalia, and take care of yourself and follow the recommendations.
Thank you very much for your help and your time. See you soon.
See you soon.